My warm wishes to one and all present here. My name is Shireen and I am pursuing my graduation in BSc Medical Course Semester 1 from KMV Jalandhar, an autonomous heritage institution. I am participating in the e-national conference in the e-poster presentation, and my topic is implications of COVID-19 and strategical development in all the aspects. First of all, let us have a basic idea of what implications of COVID-19 is. It is the involvement of us in the COVID-19 and how we can strategically develop ourselves in all the aspects. The second wave of the pandemic hitting the country and elsewhere has got to be a major concern for laying out strategies in each and every aspect. Much has been learned from the experiences since March that policy making is really important here, but there is still scope, arguably, a need to refine and improve the policy responses and overall strategic approach. As we move in the next phase, it is useful to take stock of the principles that can guide a strategy and the policies within that strategy on a wider scale. Though a vaccine has proved promising in trials, it will be taking time to roll out and assess its effectiveness. Few days before, Ayush Ministry approved the COVID-19 drug made by Dalmia, which is named as Astha 15, which will be provided to the COVID patients suffering with the symptoms like mild and moderate symptoms. The severity and profundity of the COVID 19 crisis have forced public discussion and the reflection on what those values are. We have recognized both threats and fundamental responsibilities towards our young people and their education, their mental health, and future employment. We have we trust, recognized that we should refuse to see the old people as disposable and that we must protect the vulnerable, protectively the older, weaker, and the poorer. If we take on account our country, there are different regional lockdowns which makes it very unclear for us to how to support our finances in this economic crisis. Looking at this diagram, talking on the wider scale, the worldwide scale, Germany is the country which matches to the core responses of WHO because of its widespread checking, isolation methods, and great testing techniques. Here, what happens is we need to focus on one strategy that if we are going to test for something for this disease, we need to focus on the widespread testing and not merely the possible assumptions of that particular disease. It will not only help in improving the COVID 19 vaccines, but also the outbreak of the infectious disease that we have seen coming past these months. What we all can do is that the economics, the social sciences, and all the other fields can come together to set out the options and choices in ways that allow the values to be brought to the decisions in a more clear and a transparent way. We, on our hand, are maintaining our social distances, but all the other fields they have this opportunity and they can convert this challenge to the opportunity by working together and serving the society as a whole, which is impacting the environment as well as us. In the long term, the risk that the pandemic impairs the social contract which underpins the trust and compliance is something really damaging. This is the critical period for the societies and economics across the world. Many of the risks in terms of economic consequences fall on younger age cohorts for whom there may be lasting effects. So, there is a way we need to think about, approach, and discuss the choices we have to make and the strategies we have to set. That analysis and discussion will itself have a lasting impact on us in these testing times. Thank you.